My grandmother knew I wanted to be a doctor long before it was clear to me. Or maybe that's not fair. Maybe I recognized that idea to be just the right one the first time it was ever presented to me. And it was presented to me by my grandmother at about age 5 in the form of a pudgy pink man with a mop of black hair like Moe from the Three Stooges, a red light bulb for a nose, metal-edged holes all over his body with little plastic organs in them, and a tweezer attached to a wire with which to remove these organs. A tweezer that made his nose light up with a nasty buzz if the tweezers touched the metal edges in the process. I was quite good at the game, and she told me what a wonderful, successful doctor I was going to be. She told me how I was going to help people. She told me what a good and meaningful thing it was to be a doctor. I was hooked. Interestingly, the thing about the game that made my nose light up wasn't the technical achievement of skillfully, silently removing all those little doodads from the guy in Milton Bradley's Operation game. I still remember the little plastic bucket in his knee hole meant he had water on the knee. It was somehow the feeling that I was doing a good deed, helping, healing. It felt good, it felt right. So as kids do, I decided on my answer to the question, what do you want to be when you grow up? A doctor. And I stuck to it, and my grandmother was always very proud of me. She was right. I am very good at it, but I didn't become a surgeon. I don't remember watching Marcus Welby as a kid, but ultimately it turned out that's exactly the kind of doctor I imagined being. My first family doctor I can barely remember. A quiet older man, gentle, with a quiet, friendly office. Our next doctor was the guy I wanted to be like. A very calm, cheerful, friendly, sort of goofy yet serious guy with big soft hands, a deep voice, and a chilly stethoscope. It's supposed to be that way. He never seemed rushed or stressed, and he made me feel better just by talking, just by touching. I really liked him. I went to him until I was well into college, and became best friends with his son. Even our families were friends. So when I went to medical school, I tried out and tried to love all sorts of glamorous subspecialties like plastic surgery, dermatology, otolaryngology, cardiology, but they all seemed more concerned with what they were doing than to whom they were doing it. Then I practically stumbled into a family medicine preceptorship and remembered what I was so good at. What I'm good at and what I love is connecting with people, making them feel heard and guiding and helping them through whatever's going on in their bodies or their hearts, literally and figuratively, and how it's affecting their lives. It turns out that I'm able to talk to just about anyone, any age, any race, any gender or sexual orientation, any culture, because I know how to listen with empathy and understanding. And it would seem that I know how to touch them, or when not to, how to reassure them, laugh, cry, pray, or just be silent with them. I know how to make space for them to move in the right directions and make choices, sometimes towards better health, and sometimes even towards dying. That often requires teaching or providing information. As a matter of fact, doctor means teacher. And I love answering adults and children's questions and educating them about their conditions. But I also know how to care, and people sense that about me. How to provide hope and encouragement, which are two of the most sacred and valuable roles of a physician. And how to be there with them in their lives for whatever's going on. For me, it is as much of a privilege to attend a birth as a death. These are intimate, powerful, and often complex experiences, both emotionally and scientifically. So the medical knowledge is and has to be there. I work hard to make sure I stay up to date, and I'm smart, not a genius, but meticulous and compulsive. I don't miss things, and I know when to ask for help and whom to trust. But the rest is my gift. Over the course of my career, the evolution of the American medical system in the direction of managed care, controlled essentially by huge for-profit insurance companies and the federal government, has been at great cost to the healing profession. The relationship between doctor and patient has been poisoned with the overriding considerations of cost over care, productivity over patients, authorizations over autonomy, and formulary over feeling. It has effectively dehumanized medicine. It has surgically extracted the compassion out of the profession. And on a personal level, it was just no fun anymore. I know that you can't turn a blind eye to economics. Like most people, I'm motivated by my own desire to live a comfortable and secure life financially. And any business needs to be solvent. But people turn to doctors to guide them, assist them, and know them, not to manage them, rush them, order them, or tragically even be indifferent to them. And doctors honestly, hopefully, essentially choose medicine as a career in order to make a difference, not just a dollar. I did. My passion for what I do is in the everyday creation of the kind of unique connection between a doctor and a patient that engenders trust and is by its nature healing, comforting, and caring. So I was determined to create a new kind of medical practice, or maybe an old-fashioned kind of medical practice with the newest science and technology, in which people can once again feel a connection with their doctor, not just with their insurance company, where they can feel like a human being and not just a policy number, where they spend more time with the doctor than in the waiting room. Heck, I didn't want to need a waiting room, just a reception area with a piano in it. People want access to their doctor. When someone calls and needs to talk to me or see me, I want to talk to them or see them, not ask them to navigate a diabolically complicated automated voice messaging system, which may or may not ultimately get them a call back or an appointment within a week or 3. I insist that the people who work with me hold themselves to the same standards of caring, courtesy, responsibility, and commitment to which I hold myself. I want the first question when someone comes in my office after hello to be, with a smile, "What can we do to help you today?" And in the exam room, when someone says, "Can I ask you one more thing while I'm here?" the answer should be, "Of course," not "Sorry, we're about out of time." Because again, most of all, it is the experience of being with the doctor that is the most powerful healing tool we have as physicians. Anyone with credentials like mine can learn to implement the science and do the business of healthcare, but it is the essentially human experience of connectedness with a caring professional, which is the art of medicine, that I'm passionate about and specialize in creating. As for my legacy, I'd like to leave a community of people, their parents, their children, maybe even some of their grandchildren, whose lives were better and healthier than they would have been because of their relationships with me and our experiences together. Maybe fewer smoked or abused alcohol or drugs, and many quit and recovered. Maybe fewer got cancer or more caught it early. Maybe more exercised and lost weight and didn't get diabetes or have a heart attack. Maybe some who were depressed or suffered great losses got through them with more grace or ease. You see, it's not so much a matter of the results and outcomes as it is the process. I say that life is a series not of getting overs, but of going throughs. I hope my legacy will have been to cure when possible, always to comfort, always to care, and always with compassion. And perhaps a few of my patients will play operation with their grandchildren someday and tell them what great doctors they might be.